You can see this is the lower end of the humerus from the front. And from behind. Now you can appreciate that the lower end is expanded transversely or from side to side. It forms the two condyles. These condyles have articular and non-articular parts. The articular parts, they form the elbow joint with the radius and ulna and consists of the capitulum and the trochlea. As you can see, this spherical, or rather this less than a sphere, half of a sphere, this part, this is the capitulum. This is the capitulum. The capitulum is articular in front and below, but posteriorly it is non-articular. You can see the rough part, this is non-articular. And this articulates, this capitulum, it articulates with the disc-like upper surface of the head of the radius and comes in contact in like an extension of the elbow. The inferior surface of the capitulum comes in contact with the head of the radius, and in the flexion of the elbow joint, the anterior surface comes in contact with the radius, head of the radius. Now we can appreciate here in this picture, this is the lower end of the humerus, this is the radius, this is the ulna, and this is the disc-like head of the radius that is articulating with the inferior surface of the capitulum as in the extension of the elbow joint. Now let's see the trochlea part. This is the trochlea part. The capitulum lies laterally and the trochlea lies on the medial side. Now the trochlea is asymmetrical pulley. You can see it's asymmetrical pulley, and it has articular surfaces anteriorly, inferiorly and posteriorly. Okay. It articulates with the trochlear notch of ulna. Articulates with the trochlear notch of ulna. This is the trochlear notch. This is the trochlear notch of the ulna. And as I have already shown you, this is the trochlea. This is the upper end of the, this is part of the trochlear notch of the ulna. You can see that the ulna is articulating here with the trochlea. This is the anterior view. Okay. This is also, this is from the posterior surface of the trochlea articulating with the ulna. If we notice or look carefully, we can see there is a medial flange of the trochlea which is broad on the anterior surface, and its medial margin, if you notice, it is extended. Its medial margin, it extends about 6 mm below the lateral margin. You can see this is extending further down this. And the ulna, it comes in contact with the posterior inferior surface, that is the posterior inferior surface of the trochlea in extension, but during flexion it slides in the anterior surface of the trochlea. And this medial flange, this extended medial flange of the trochlea, this results in the forming of what we call the carrying angle. Okay, this now we can come to the non-articular parts in the lower end. These are the three fossa, two on the anterior, the radial fossa, the coronoid fossa, and posterior surface has the olecranon fossa. Apart from the three fossae, we also have the lateral epicondyle and the medial epicondyle, lateral and medial epicondyles. Now the radial fossa, this is the radial fossa. It lies immediately above the capitulum on the lateral side, and this accommodates the margin of the head of the radius in full flexion. Okay. Then we have the coronoid fossa. This lies above the trochlea, medial to the radial fossa. This is the lateral, this is the medial. So the coronoid fossa is here, and it is occupied by the anterior margin of the coronoid process of the ulna during flexion of the elbow. And on the posterior surface we have the deep depression, which is the olecranon fossa. This lodges the apex of the olecranon process of ulna in extended elbow. Sometimes this floor of the fossa may be deficient, and all the non-articular fossa, all these non-articular fossa are covered or are within the attachments of the articular capsule covered with synovial membrane. Then we can come to the medial epicondyle. This is the medial epicondyle. It forms a blunt and palpable projection which is directed medially and slightly backward. Medially and slightly backward. The tip of the epicondyle, it gives attachment to the anterior and posterior bands of ulnar collateral ligament, and this anterior surface, or rather the antero-inferior surface, we can notice here there is a impression here for the common origin of the superficial group of the flexor muscles of the forearm. This is the posterior surface of the base of the medial epicondyle, and here it is slightly grooved because it lodges the ulnar nerve here before the nerve enters the forearm between the two heads of the flexor carpi ulnaris muscle. And the nerve, actually this ulnar nerve here, can be rolled against this surface of the bone and produces a characteristic tingling sensation. Now here is the lateral epicondyle. We can note that the medial epicondyle is more extended and more prominent than the lateral epicondyle, which is directed laterally and slightly forward. The tip of this lateral epicondyle gives attachment to the radial collateral ligament, and on the anterolateral surface, here, we can see a impression for the common origin of the superficial group of extensor muscles of the forearm. So on the medial epicondyle we have the common origin of the superficial group of flexor muscles of forearm, and on the lateral epicondyle we have the origin or common origin of the superficial group of extensor muscles of the forearm. and the posterior surface which was non-articular. This gives the attachment to the, here it is, there is attachment of the anconeus muscle or origin of anconeus muscle. Now the capsular attachment in the lower end, it runs as a continuous line including the two fossa on the anterior surface, excluding the two epicondyles. So as we include the two fossa here and exclude the lateral epicondyle, then posteriorly it includes the olecranon fossa and again excludes the medial epicondyle this way. Coming to the shaft that intervenes between the upper end and the lower end. The shaft, it is cylindrical in cross section in the upper part and triangular in cross section in the lower part. Now the shaft has three borders and three surfaces: the anterior, medial and lateral borders, and the anteromedial, anterolateral and the posterior surfaces. Coming to the anterior border starts from the greater tubercle in the upper part, where it forms the lateral lip of the intertubercular sulcus, and it can be followed down up to the between the two fossa. Okay, so from greater tubercle, anterior lip, from the anterior part of the greater tubercle up to the lower end between the two fossa, radial and the coronoid fossa, that is the anterior border. Then comes the medial border. Okay, now the medial border starts from the sharp tip of the medial epicondyle. It remains, the border is sharply delineated as we can see here, and forms in the lower part, it forms the medial supracondylar ridge. Then as we follow up, it has a slight rough patch, and then it can be traced above up to the lesser tubercle, and it also forms in the upper part the medial lip, the medial lip of the intertubercular sulcus. So from the tip of the medial epicondyle to the lesser tubercle, forming the medial lip of the intertubercular sulcus, that is our medial margin. And then we have the lateral margin. The lateral margin also, as you can see here, it starts from the tip of the lateral epicondyle, and then it remains sharply delineated in the lower part, and it is called the lateral supracondylar ridge here. And then we can follow it up to the middle of the shaft, where it fades due to the presence of a spiral groove here. Then as we follow up, it blends with the posterior limit or margin of the greater tubercle. So from the tip of the lateral epicondyle to the posterior margin of the greater tubercle, that is the lateral margin. To the surfaces of the shaft, the anterior border, between the anterior border here and the medial border. This surface is the anteromedial surface. The features of the anteromedial surface, as we can see, in the upper part there is the intertubercular sulcus. In the upper part is the intertubercular sulcus, and this lies between the greater and the lesser tubercles. And here passes the tendon of the long head of the biceps brachii along with its synovial sheath. Now, as we can see, the intertubercular sulcus, it has a medial lip and a lateral lip and a floor. These three parts give attachment to three muscles or insertion of three muscles. The medial lip gives attachment to the teres major, the lateral lip gives attachment to the pectoralis major, and the floor to the latissimus dorsi. So, we may remember the mnemonic lady between two majors, latissimus dorsi between teres major on the medial lip and the pectoralis major on the lateral lip, and the attachment of the pectoralis major is the maximum or the longest, and that of the latissimus dorsi is the shortest. Then we have in the middle, we have the rough strip. As we can see, there is a rough strip here. This is for the attachment of the coracobrachialis muscle. This is for the insertion of the coracobrachialis muscle. Also, close to the medial border, here close to the medial border, we can see the nutrient foramen. You can see the nutrient foramen, which is directed to the lower end of the humerus, and this is usually a branch of the brachial artery. In the lower part, this lower part of the anteromedial surface, this rounded anterior border along with the anterolateral surface, lower part of the anterolateral surface, this area, this gives attachment to the brachialis muscle, or this is the site of origin of the brachialis muscle, and this extends up to the lower limb of the spiral groove and lower part of the spiral groove, and also the lower part of the V-shaped insertion of the deltoid muscle. This medial supracondylar ridge, it gives attachment to the medial intermuscular septum, and it lies between the flexor and extensor muscles of the forearm, and this medial intermuscular septum passes behind the attachment of the coracobrachialis, Okay, now this medial septum, it is pierced near the middle of the, rather little above, near the middle of the shaft by the ulnar nerve and the superior ulnar collateral artery, and slightly above the medial epicondyle, here it is pierced by the posterior branch of the inferior ulnar collateral artery. Also, this lower part of the medial supracondylar ridge in front of the medial intermuscular septum, this part, this is the site of origin of the humeral head of the pronator teres. The anterolateral surface, it lies between the anterior border and the lateral border. This is the anterolateral surface. Now, if you note the middle of the shaft, we can see a V-shaped rough area. This is called the deltoid tuberosity. Here, this part receives the insertion of the deltoid muscle. So, the part above the surface is covered by the deltoid muscle intervened by a subacromial bursa, and below this line it is covered by the origin of the brachialis muscle, as we already mentioned. Now, the you can see the supracondylar ridge here. This gives attachment to the lateral intermuscular septum, and it is pierced by the radial nerve and the anterior descending branch of the arteria profunda brachii. If we note, we can see that in the upper two-third of this narrow strip of the supracondylar ridge is attached is the origin of the brachioradialis muscle in the upper two-third, and in the lower one-third is the origin of the extensor carpi radialis longus muscle. Okay. Coming to the posterior surface of the shaft, it is between the lateral and medial borders. Now, this is the medial epicondyle because this is more prominent. So, between the medial and the lateral borders is the extensive posterior surface, and in the middle of the shaft of the posterior surface we can appreciate a spiral groove. Okay, please note the direction of the spiral groove, which is downward and lateral. The direction of the spiral groove is downward and lateral, and here it transmits the radial nerve along with the profunda brachii vessels. Okay. In the lower part of the floor of the groove, in the lower part of the groove, we already mentioned that the brachialis muscle extends, the origin of the brachialis muscle extends up to this lower part of the groove. If you take a closer look, this is the spiral groove, and above that spiral groove we can see an oblique ridge. This is for the origin of the lateral head of the triceps. This one is for the origin of the lateral head of the triceps. The upper one-third of the posterior surface above this oblique ridge is under cover of the deltoid and is crossed transversely behind. Above this is the deltoid, and here obliquely behind the surgical neck lies the axillary nerve and the posterior circumflex humeral vessels. Rest of the surface below the spiral groove, this is the spiral groove, and below the spiral groove is extensive and smooth and provides origin to the medial head of the triceps. All of this is for the medial head of the triceps.